If you think that you're having a miscarriage because you're bleeding when you're pregnant, you can seek help from your GP or accident and emergency, and they may refer you to the early pregnancy unit. We have another video that tells you what happens at the early pregnancy unit, because they'll usually run some tests. If you think you're having a miscarriage and you're in a lot of pain, I would really recommend seeking help. There are 3 different treatment options available in the UK, and these would all happen after you've spoken to the early pregnancy unit. The first is known as watchful waiting, and this means they'll run some tests and you'll be allowed to go home, so you won't have to stay in the hospital. They'll give you some painkillers to take at home, so something stronger than you can buy from the pharmacy, and a phone number that you should phone if you start to feel more unwell or have an increase in pain. The second option is something called medical management, and this means that they'll give you some medicine either as a tablet that you would swallow with a drink, or something to insert into your vagina, and that will make the miscarriage happen more quickly. Sometimes the doctor you see may recommend this option because you're starting to look unwell. So your clinical signs are showing that you're getting to be quite poorly. And other times it could be your decision, so that you would just want the miscarriage to be over as soon as possible, and you might then opt to take the medicine. The third option is surgical management. And again, this might happen because you haven't lost all of the parts of the pregnancy. So they need to get the rest of that out because it could cause an infection. Or alternatively, it could be that you want the pregnancy to end as soon as possible because you know it isn't going to be viable. If you have surgical management, that means that you would be given a general anaesthetic. So they would normally put a little tube in the back of your hand that they would give you the medicine through, and then you would be asleep during the procedure. You wouldn't remember anything. That would happen in an operating room, and they would then do the surgery to remove the pregnancy, and you would come around from that procedure in the hospital before you then go home.